I thought toothpaste was toothpaste.
All toothpaste were about the same.
Toothpastes were pretty much toothpaste.
Generally, as long as the toothpaste had fluoride in it, it was fine.
I really didn't have much of an opinion about toothpaste.
I would recommend any toothpaste that had fluoride in it to my patients.
For almost 20 years, the whole world wrestled with how to prevent and treat dental caries. And fluoride emerged as the way to do that. So it was natural then to turn our attention to the surrounding areas of the teeth, particularly the gingival tissues, to find a way to treat and prevent gingivitis, the early symptoms in gum disease.
I first became interested in Colgate Total because I knew it had a special ingredient called triclosan, which is antibacterial. I knew it would help my patients fight gingivitis.
We know that triclosan is a broad-spectrum antimicrobial. We have over 300 strains of bacteria in our mouth, and so we really need something that's targeted to attack the majority of those.
What triclosan does as an antiseptic is it attacks the cell wall and essentially puts little holes into the cell wall that causes the bacteria to die.
If I start to compare stannous fluoride with triclosan, both of these agents are broad-spectrum antimicrobial agents inhibiting gram-positive and gram-negative bacteria. The difference really is that triclosan is a very potent anti-inflammatory agent, and so you get a two-pronged effect from triclosan, both inhibiting the flora and inhibiting the inflammatory response, which you would not get from stannous fluoride.
It's hard really to find an agent that's better, that can be used in the mouth, than triclosan.
One of the unique aspects of this formula is the fact that the formulation is so structured and constructed that the triclosan attaches to the teeth for a long period of time.
We know that triclosan and the copolymer that allows it to remain in the mouth will keep it effective for 12 hours after use.
The copolymer that we use in Colgate Total was specially designed to make it unique for oral care products.
I must say that with the triclosan coupled with the copolymer, and thus having considerable substantivity, you would believe that triclosan would be much more effective, and indeed the data would suggest that that substantivity gives triclosan a much more effective role in controlling both plaque and gingivitis.
That it does help fight bacteria and help fight cavities for 12 hours, even if you're eating or drinking.
Well, when we first arrived at a formula that we thought was optimal, it was clear to us that we needed the best technical, scientific clinicians in the world. We selected people who had expertise in plaque and in gingivitis and in caries and in calculus. And we sought these people out and we asked them if they wanted to get involved in this program, and they did.
I conducted a clinical study for Colgate Palmolive, testing the efficacy of a dentifrice containing triclosan on the severity of gingivitis and the formation of supragingival plaque.
Main purpose was to make sure it was safe and that it was effective in controlling gingivitis.
The study demonstrated that triclosan was effective in reducing the severity of gingivitis and retarding the formation of supragingival plaque.
We've had maybe 30 to 40% decrease in gingivitis, which it was surprising to me, but it's very consistent.
When we see the volunteers, we find those who have quite a bit of improved gum condition. On inquiry, they almost always tell us that they are using Total toothpaste.
I have seen amazing reduction in bleeding and gingivitis in these patients. The compliance rate is amazing, and as they come in to see me every 6 months, there is definitely a difference.
So this particular case, we tested these 3 different toothpaste, and we tested their effectiveness in removal and or prevention of tartar or calculus from people's teeth. A total of about 140 subjects participated in this study, and this study lasted 3 months. The most surprise to me was, as I learned afterwards, that the Gantras product, which does not contain a pyrophosphate, created a statistically significant reduction in cartilage formation.
And when they had asked me to look in their mouths at their recall visit, I did notice a significant difference in the stain level, in the tartar buildup.
Inflammation is the response of the body to an insult, and that insult may be bacterial in nature or it may be traumatic. And the body's cells will produce a number of mediators to address that insult and try to contain it. Once inflammation occurs, the individual will begin to have a response in the blood vessels, and the blood vessels in the area will become leaky. And you will have the movement of transudate through the vessels into the tissue, and that's why you get swelling in those areas. Where that is not contained and taken care of, and the stimulus is still there, then we move into chronic inflammation. The mouth is a site of chronic inflammation. Gingivitis, if left untreated, will eventually become chronic. And so many patients will have chronic gingivitis, very common in the United States.
Triclosan, in addition to being an antibacterial agent, has an inherent anti-inflammatory component to it. And studies have demonstrated that it can reduce the inflammatory mediators of prostaglandin.
Triclosan is one of those formulas which acts twice, really, on two forms. Number one, it reduces the total number of microorganisms in the oral cavity, and also it reduces the inflammatory process within the mouth.
I've had a long history of studying the role of anti-inflammatory agents in inhibiting or blocking periodontal diseases, and it's quite clear that triclosan is an excellent anti-inflammatory agent, and so I see an era in which we look at sort of a two-pronged approach to the control of gingivitis and other periodontal diseases. Triclosan's antimicrobial effect and triclosan's anti-inflammatory effect. What more could you want than sort of a two-pronged approach?
I actually think that Colgate Total is very different from other toothpaste. It's an all-encompassing toothpaste. Like I said before, it not only reduces gingivitis, but plaque and calculus, and I believe it is the only toothpaste in the United States that contains triclosan.
I use Colgate Total. I've used it almost, I guess, since we did the studies back in the 90s. My family uses it, and we even have to pay for it.
Colgate Total is the only one that I'll go out and spend money on.
I personally use Colgate Total at home, and I don't squeeze them out of little tubes either. I do purchase it for myself, my family, and my staff.
I especially like that it helps kill bacteria and keeps your mouth fresh for 12 hours.
I found that there's less bleeding and less decay because they are using the Colgate because they like it and they're brushing with it, which is what's important.
I have used Total ever since it was introduced into the U.S. I also recommend it to my patients. It's just the toothpaste of choice.
I use Colgate Total.
This morning I used Colgate Total, as I have been doing it for last over a decade.
I became a firm user of Colgate Total, I think, 10 years ago, somewhere there, because I now know that it works for me, and I really do use it.
We have the total in the house. He puts it in his drawer in the bathroom, and if we have something else, he'll put it in my drawer, and he goes, "You finish this up," and he'll use the Total, and I'm like, "Excuse me." And of course, they ask me what is the best toothpaste on the market, and they trust my professional opinion, and of course, I recommend Colgate Total.
I find that I get good results with it, and that's why I would recommend it.
It seems to have good compliance, good results, and it tastes good, so what more can you ask for?
I do believe that Colgate Total is a better product than most toothpastes on the market.
It's to gingivitis and gum health what fluoride is to dental decay.
It has both an antibacterial effect and an anti-inflammatory effect.
There really isn't any reason to use another toothpaste.